How to tell if you're suffering from referred pain. Trigger point therapy. In some cases, the pain that you may be feeling may not be the cause of an issue in that area. In some cases, the pain may actually be caused by trauma in another related area, called a trigger point. Trigger points can create something called referred pain. Referred pain starts at a trigger point and it moves along the tissues that are supplied by the nerves. A trigger point is an easily irritated spot that can be very painful to the touch. A trigger point is the most vulnerable spot in a taut band of muscle fibers. A troublesome trigger point looks like a tender nodule, but the real problem is not the nodule, but the referred pain that it causes in other areas. Many doctors with conventional training fail to diagnose some types of pain correctly because they refuse to acknowledge the importance of trigger points and referred pain. However, many alternative care practitioners are able to accurately diagnose referred pain. They diagnose referred pain by looking for specific signs and symptoms as well as for pain patterns. They often use external palpation to discover painful nodules as well. Usually, they are able to discern a hard nodule in the middle of a band of muscles. To feel these nodules, they may run their fingers perpendicular to the muscle's direction. While doing this, they may look for a twitch response. Some of the larger muscle groups may even have clumps of trigger points, and these clumps can be diagnosed in similar ways as the individual nodules can be diagnosed. Some practitioners look for heat in particular areas to help them diagnose referred pain. Once the practitioner has diagnosed the trigger point, he or she can start to treat it. There are several different methods that can be used to treat referred pain. This includes ultrasound therapy, mechanically induced vibration, electrostimulation, and even low-level laser therapy. Most practitioners use deep pressure to treat trigger points. They may use their elbows, their feet, and even certain tools to help put pressure onto the trigger points. Some practitioners use two of their fingers to pick up the muscle in a pincer-like grasp. If you feel that you have an undiagnosed pain in a certain area, it may be related to a trigger point. If heating pads and stretching does not help, there is no reason to lose hope. The right practitioner will be able to diagnose your trigger points, and they will be able to help alleviate the pain that is coming from those spots. Once they have deactivated the pain coming from your trigger points, you will regain your natural range of motion as your taut muscles return to their regular size.